I want to talk to you about the coronavirus. Preparedness to deal with the virus at some of Ghana's land borders has been questioned as Togo, Nigeria and Burkina Faso all record cases of the deadly virus that has claimed over 4,000 lives so far. Early this month, Health Minister Kwekwa Menu, after a tour of the airports and other designated holding centers with President Akufo-Addo, noted the country's land borders have been put on high alert to check entrance from neighboring countries.
The same measures that we have put in place in the Kotoka International Airport are the same things that we are replicating along all the land borders, especially the two major ones, Elubo and Aflao. But we haven't forgotten about the approved routes across length and breadth of our country, as far as Paga, the Gonokrom and Badukrom and the Sampa area, everywhere across the country. We are on high alert, and now we have got some of our directors who are moving around to actually check, just like the president went around this afternoon, to make sure that they have taken our advice and instructions very seriously, and they are working on them.
Now, 2 days after the health minister's announcement, this Ghanaian who came into Ghana from Togo, which has recorded a case of the virus, has been narrating his experience at the border to Daniel Dazi.
Well, if coronavirus is in Togo, then seriously, as Ghana, we are in a colossal screw-up. Because, honestly, Daniel, there was no form of check. On my way back, they took my passport, asked me where I went to, what I went to do, and that was a stamp. No form of medical check whatsoever. I think the only thing they were concerned about was whether or not you had the legal right to enter or not. So on our way to Togo, there was a bit of a kerfuffle. The guy who came for my stamp, for my passport, wanted some money before he stamped it to prove that I'm going to Togo. I told him I was not going to pay any money, and he left angrily. And so I had to go back to the border guys and tell them, hey, this is my passport, I'm going to Togo, will you stamp it? So I could have easily entered Togo without my passport being stamped. And I went with a friend whose passport wasn't stamped. And so it was a few minutes after we had entered Togo that he actually had to come all the way back to the border and have his passport stamped.
Which means that it's possible you would not have had a record that you had crossed the border and people know how you got there.
Yes, I think it's very possible, and I won't be surprised if there are a lot of people who don't have any records of going in and out of the Togo border.
Do you think we are safe from coronavirus?
No, I don't know. I don't think we are safe at all. I promise you, I didn't know anything about coronavirus, even being remotely close to Ghana, till I got to Ghana way later in the evening, and someone sent me a news article that there was an outbreak or there was a possible case in Togo. The same day I was in Togo and out. So no, I don't think as a country we are safe at all, honestly.
That's a traveler sharing his thoughts with Daniel Dazi, Director of Public Health of the Ghana Health Service. Dr. Bedusa Kodie says they're looking into the claims of the lapses as reported by this gentleman at the Aflao border area, which is one of the high traffic points for Ghana. He's also been speaking about outcomes of a day-long meeting between health officials and the 16 directors of health on the way forward in dealing with the disease should it get into this country.
The idea is to assess and get first-hand information, what they have been reporting of the preparedness of the various regions. And we had already gone to some of the regions, the Director General and myself, we've been to some of the regions to assess what they are doing. Clearly, they are doing quite a lot of things, not very different from what we are doing at national level. Whatever mechanism you put up here should just run down through the region, and the regional directors also have the responsibility to ensure the districts and the health facilities and even the community activities are adequately done. And those are the things that we deliberated on and discussed. And based on the information we received, we are quite happy about the progress so far.
And the financial commitment to this has been forthcoming?
Indeed, we have a master plan. And this master plan has been we've added cost to it. And we have some amount that we anticipate to get the things. And most importantly, this has been looking into short-term, mid-term, and long-term. At any time, what I require as the lead in the operational activities is that when we need specific things, if they rarely mention PPEs, how do you get a PPE, which has already been costed in the plan? So we go to the DG, the minister, he provides the PPEs. When we require place for holding, place for treatment, the logistics for case management, logistics for laboratory confirmation, these things are provided. So for now, I think we are doing well as a country, and what we have no reason to be worried about our preparedness.
That's Dr. Bedusa Akodia, who is the Director of the Public Health of the Ghana Health Service, updating us on the coronavirus.